Light, camera, actions, and we're back with a very, 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 very special guest. I'm Laura Thompson, the host of The Coffee Break. As a matter of fact, I'm the fabulous, friendly, feisty, fierce, and phenomenal creator and CEO of TAN TV, the African American Network, where we have a local feel with a global reach, and you're tuned into The Coffee Break. I was sitting here minding my own business again. I thought my coffee break was over. I hope I won't get in trouble for staying over a little bit longer, but we're here with a phenomenal guest. But before we get started, we're going to allow you to introduce yourself, tell us what you do, why you do it, and all of those good things.
Yeah. So my name's Dr. Anita Gould. I'm a family nurse practitioner and owner of Oud Wellness and MedSpa here in San Antonio, Texas. I've been a nurse practitioner for about 7 years, and I've recently opened up my clinic as primary care, and we do a lot of aesthetic services. And we also focus on things like weight loss, sexual health, and a little bit of everything in between when it comes to aesthetics. And I started in this business because I retired from the military after 30 years, and I wanted to continue to give back to my community and help in any way I could to serve.
Wow, I don't believe she served 30 years in the military. Look at her, she looks like a teenager on here. But thank you, Dr. Gould, for coming on and talking to us a little bit about your practice. Mm-hmm. The things that you do and the services you provide are very, very important, mm-hmm. you know, to the community and to the community at large. And I think it's important that you've taken a progressive and an innovative approach to serving the medical community. So we appreciate you coming on. So you talked about weight loss. Summer's coming up. It's mm-hmm. scooting up on us pretty quick. And so a lot of people want to lose weight. Weight loss is a hot topic mm-hmm. all the time. People are always trying to do it. And so can you give us a little bit more information on, what your program entails and, why you do that?
Well, we have several different programs surrounding weight loss. One of the big ones is we use semaglutide, tirzepatide, GLP-1 injections. We do liquid lipo. We do some oral supplements for some that don't care for the needles. We also do some IV hydration weight loss programs. And I actually started doing it because I was focusing more on primary care, but a lot of my patients kept asking me about these injections, and so I decided to try it myself. And after being on the injections myself, I actually lost 25 pounds in 4 months, and I was on 2 different blood pressure medicines, and I came off of one completely, and the other one I went down to half the dose. And I'm like, okay, all right, I believe a little bit more in this, and so now I can actually tell my patients about this and how I feel that it works. But I try to, do a little bit different things. I offer them some skinny shots along with it, and I try to work with them weekly to make sure they're making good choices, and they're going to look at this as a lifestyle change, not that it's a diet, because you need to make changes so they can stick. And so you don't want to just gain it all back. So you really have to, it takes 90 days to change a habit, and we always ensure everyone starts with 90 days. So after those 90 days, you will have put some good habits in place and change, and, to have meal plans in place and exercises to do things to make your overall lifestyle different.
Wow. So sometimes when people are taking certain types of medication, I don't know if you would consider this medication, the shots, but you named some medical terms that, I really didn't understand. So can you kind of explain a little bit about, how they work? Mm-hmm. Or
well, some the GLP-1, they work by they decrease your appetite, they slow your digestion. Some ladies that suffer from PCOS, it helps with that. Some people that don't get good sleep say they get the best sleep of their life. Wow. And some, they get a little bit too tired, so we will offer B12 shots, or we'll give them, like I said, the skinny shots along with it. And the skinny shots has a component called MIC that actually helps the medication work a little bit better, and it also has some cardiovascular benefits and help with energy and metabolism. And we also, we work closely with them because there are some reasons people can't take those medicines. And you know, you hear the big buzzwords, you'll hear some side effect that is very minimal in a very small population, but one of the things is gastroparesis. And basically that's when the stomach gets paralyzed and the food pretty much sits there and rots. So we want to make sure, you know, you're not having some of those problems, but some of the biggest side effects you have is nausea, constipation, and diarrhea. And so we like to monitor you and talk with you on a regular basis to make sure you're not having any of those concerns, so we can make sure we get on top of them before they progress to something a little bit more dangerous.
Wow. So the beauty of it is, though, is that you're a nurse practitioner and you're
Yes, ma'am.
you're trained and you understand how to navigate, you know, through those side effects and
Yes, ma'am.
the whole process. There's another thing that you offer that a lot of times people don't think about, but they're not aware of the services, or they just don't talk about them. But the sexual health, you have a program for that. Can you explain how that works?
So one of the things we do is we use platelet-rich plasma, where we draw your blood, and we use that for women. It helps with lubrication, tightening of the vagina, increased orgasm, and urinary incontinence. And with the men, it helps with increased erections, a little bit growth in the size, and also urinary incontinence. And so as we get older, sometimes there's just some things that we've went through where, you know, those type of things just happen to go down. With men, sometimes if they're taking certain anti-anxiety medicines or depression medicines or certain hypertension medicines, they might have some problems with erectile dysfunction. Or sometimes when women start going through menopause or just other problems that they've had, we have issues in that area. And so I like to let everyone know it's okay to talk about it. A lot of society deals with it, and there is something that you can do about it that can turn things around and make everybody else in the household pretty happy.
Yes,
Yes.
And a little bit less stressful.
Yes.
So can you explain a little bit about how the procedure works? Is it a pill? Is it an injection? What is?
So we actually will draw your blood and we'll spin it down and we'll get the platelet-rich plasma off the blood after we've spun it down, and we numb you. So it is in an injection form, but we do numb you first, and then we give you the injections, and pretty much you can go home the same day, no issues. It's a pretty quick procedure. It probably takes longer to draw the blood than to actually give the injection. So it's a pretty good procedure, and I get lots of great comments about the results. Sometimes I get a little bit more information than I would like, but people do have great results with this procedure.
Okay, because I was telling someone about it, and they were like, I said, I think they might numb you or put you to sleep or something. I don't know.
Occasionally, some people don't numb you, but I prefer to numb you because I just can't imagine injections in that area with no numbing cream. So I do numb.
Wow. So you are tuned into the Coffee Break on TAN TV, the African American Network, where we have a local feel with a global reach, and we're here with the phenomenal and amazing nurse practitioner, Dr. Anita Gould. And so we really appreciate you stopping by to talk a little bit about your practice and your services, and some high demand services, you know, I might add. Dr. Gould has been in business for, getting ready to celebrate her second
2
year
years,
anniversary. Yes. And so, you know, this is a great opportunity for her to get the word out about the great services that she provides. But before we go, can you explain how people can get in touch with you and how they can, you know, connect with your services?
So you can call our office to make an appointment at 210-900-5495, or you can book an appointment online at www.hautewellness and medispa.com. So wellnessandmedispa.com.
Thank you so much for stopping by. It's been a great
Thank you for
conversation.
having me.
I wish we could talk some more about this because it's a hot hoot topic.
Thank you.
All right, well, thank you. Have a good day. The rest of your day.
Thank you.